Next, we're preparing hospitals for what's coming. Those 40 unvaccinated adults have a good chance of getting COVID-19, and some of you will get very sick. That'll mean hospitals are going to get extremely stressed again, both in terms of equipment as well as personnel to care for those who get sick. That's why my administration has stockpiled and pre-positioned millions of gowns, gloves, masks, and ventilators. We call it PPP. We're ready to send them immediately to any state that needs more. In addition, I've directed the Pentagon to mobilize an additional 1,000 troops to be deployed to help staff local hospitals and expand capacity. That's 1,000 military doctors, nurses, and medics. We've already started moving medical teams. They've already landed in Wisconsin and Indiana this week. This is on top of 300 federal medical personnel that are now on the ground, having deployed since we learned about Omicron. Look, while we know staffing is the biggest need for hospitals, some may need more beds as well. We're prepared. I've directed FEMA to activate the National Response Center and begin deploying teams now to provide additional hospital beds. We'll begin to construct emergency capacities near hospitals, in parking garages, and nearby buildings to be ready if needed. And the federal government is paying for all of this, period, all of it. Further, FEMA will deploy hundreds of ambulances and EMS crews so that if one hospital fills up, we can transport patients to beds elsewhere. This week, we'll send dozens of ambulances to New York. Our doctors, nurses, hospital staffs have gone above and beyond during this pandemic. The strain and stress is real. I really mean it. It's real. And we'll have their backs, though. We have to let them know we have their backs. Finally,